Ever seen two pregnancy tests and gotten different answers? One might say not pregnant and the other pregnant, leaving you worried. Many couples feel confused and anxious in this situation. Doctors say both tests are looking for the same pregnancy hormone, HCG, but they do it a bit differently. In this video, we'll break it down step by step. By the end, you'll clearly understand how urine tests and blood tests work and which one can show a pregnancy first.
Doctors and experts explain that all pregnancy tests are detecting the same hormone, human chorionic gonadotropin, HCG. This hormone starts rising once a fertilized embryo implants in the uterus, usually about 6 to 7 days after conception. In those first weeks, HCG rises very quickly, typically doubling every 2 days. That rapid rise is why even waiting a few days can change your test result. It's normal to wonder which test will catch pregnancy first. A blood test done at a clinic can often pick up pregnancy a little earlier than an at-home urine test. Medical sources note that blood tests are more sensitive, detecting very small amounts of HCG. For example, a blood test can confirm pregnancy about 7 to 10 days after conception, sometimes a few days before a urine test would turn positive. On the other hand, a home urine pregnancy test usually becomes reliable around the time of your missed period, about 12 to 15 days after ovulation. Both tests are finding HCG, just in different samples.
This is where many parents get confused. The blood test isn't giving a different answer. It's just finding the same hormone sooner. If you test very early and one test is negative while the other is positive, it often means too soon to tell, rather than a contradiction. Doctors emphasize that an early negative usually means the hormone level is still too low, not that something is wrong. False negatives are common when you test before the missed period. In practice, medical advice is to wait and test again in a few days if your period still hasn't arrived.
Let's look at each test in simple terms. Urine tests are usually done at home. You pee on a stick and it reacts if HCG is present. Most modern home tests claim about 99% accuracy when used exactly right. However, that accuracy depends on timing. Home tests have a certain detection threshold, often 20 to 25 MIU per ml of HCG, though some sensitive ones detect as low as 10 MIU per ml. In practical terms, that means if you test before your missed period, your HCG level might not have hit the threshold yet. To improve accuracy, doctors recommend using first morning urine, it's more concentrated with HCG, and reading the test at the time specified in the instructions. Importantly, a single negative result one day is not final. If you still haven't gotten your period after a couple of days, take another test. Many home tests even suggest retesting if the first one was negative but your period doesn't start. On the flip side, a blood test is done at a doctor's office or lab. It uses a vein sample and can either be qualitative, yes, no, or quantitative, measures exact HCG level. Because it measures HCG in blood, it can detect very low levels sooner. Penn Medicine notes that blood tests can detect pregnancy earlier than a urine test. In fact, a clinic example pointed out that their quantitative blood test can find pregnancy about 24 hours earlier than their urine test. So, in a perfect scenario, a blood test might tell you yes a day before an at-home test would. But remember, even a blood test can give a negative if it's really early. Doctors usually suggest waiting at least a week after your missed period for a blood test to be sure, since results still depend on how much HCG your body is making. Also, blood test results often take a day or two to come back from the lab, so it's not an immediate answer.
Many people think, if one test is negative, I must not be pregnant. This isn't true. Both tests search for HCG, so a negative at an early stage often just means the hormone hasn't risen high enough yet. Blood and urine tests are detecting the same hormone. Think of it like checking the seeming progress in two ways. One test isn't wrong, it's just earlier. Another common myth is that home tests are unreliable. In reality, by the day your period is due, any good home test should be accurate. The surprise is that by the time your period is late, blood and urine tests always agree. The real difference is in those few days earlier. If you're still unsure, talk with a healthcare provider, but there's usually no need to panic over a one-day difference.
Now, what isn't the focus of these tests? They do not tell you anything about the health of the pregnancy or when exactly conception happened. They just signal HCG is here. That means if your test is positive, you should follow up with prenatal care and, if needed, an ultrasound later, but no need to worry immediately. Likewise, a negative test doesn't address anything about your health. If at any point you experience severe symptoms, for example, heavy bleeding that soaks a pad in an hour, sharp abdominal pain, dizziness, or fainting, contact your doctor. Those could be signs of something like an ectopic pregnancy or other issues, though often even these symptoms have other explanations. The tone here is stay calm and call your doctor if something feels very wrong. You're not overreacting by asking for help. It's just a precaution. It's also important to know about chemical pregnancies. This is when HCG briefly rises, leading to a positive test, and then falls, causing an early miscarriage. It can feel heartbreaking, but it's very common and not your fault. If you see a faint positive followed by a period, you might be experiencing this. We cover chemical pregnancies in our next video, early loss, not your fault, to give you more clarity. But for now, just understand that it doesn't mean you did anything wrong. It's often just how a very early pregnancy ended on its own. Let's recap calmly. By the time your period is late, any good pregnancy test should tell you the truth. In practice, a blood test can confirm pregnancy a day or two sooner because it can see lower HCG levels. Urine tests are super convenient and almost as reliable once you wait until your period is due. If you get a negative result too early, it usually just means to wait a bit and try again. Many couples worry through this phase, but as we've learned, it's very common to see minor differences. We've looked at expert guidance so you know this is normal. You're not alone in feeling anxious, and these tests will make sense soon. What matters is that you stay patient and gentle with yourself. If questions remain, a follow-up with your doctor can provide reassurance and next steps. Remember, you did the right thing seeking answers. By now, you should feel clearer on how blood and urine tests compare. Trust that the confusion will resolve as time goes on, and that many parents have felt exactly how you do now. There's support and reliable information out there, so you're in good hands.
You're not alone in this. Remember, by about a week after your missed period, any good test will be clear. For now, try to stay calm and patient. If you have more questions about early pregnancy signs, we have more videos to help. For example, our next video is on chemical pregnancies, early loss that's not your fault, which many families find helpful. If this video brought clarity, consider watching that next. Take care, and we're with you through this journey.